The Transplant Surgery Fellowship at the University of Minnesota is the oldest in the country and probably in the world. And it's a well-rounded fellowship with great degree of autonomy, and those are the two highlights of the fellowship: the breadth of training and the autonomy that's offered to fellows so they can be the best transplant surgeons when they finish.
So I think the transition from general surgery residency to abdominal transplant fellowship definitely takes some time, but I think the faculty here really give you the perfect mix of early autonomy, so you feel like you're getting better early on from the outset, as well as guidance when you need it, so you don't feel like you're getting overwhelmed early on in your fellowship.
Each of the fellows rotates on the different organ services, the liver, pancreas and donor and kidney transplant service, as well as doing some pediatric abdominal transplant surgeries. And each of those rotations allows them to become adept at the different facets that are involved for those different organs. And so there's a lot of opportunities to explore their surgical skills on the inpatient side, but also on the outpatient side, both in adult and pediatric patients.
Our fellows experience many of the different operations involved in transplant surgery, from the basic operations involved in transplantation, kidney, liver, and pancreas transplantation, but also the accessory surgeries involved, taking care of the patients afterwards, dialysis access surgeries, so hepatobiliary surgery, total pancreatectomy and auto-islet transplant. They take care of a lot of patients with complex organ disease related to their organ failure.
I think the true benefit of training here is really being able to learn all of transplant, not just learning the surgeries, but learning how to match the right organ up with the right patient and who to transplant and who isn't going to do well with transplant. Because I think that is truly the art of transplant.
I think here in the Twin Cities, there's a great opportunity to see patients from across the region, from many different cultures and backgrounds, as well as different disease processes. So fellows here get a great exposure to those different types of patients and what the organs and diseases that bring them here for treatment. They're able to become very adept at not only doing the surgeries, but caring for those patients both before and after in the inpatient and outpatient sides.
We also have a cultural diversity in Minnesota. We have a very strong Somali and Hmong population, maybe one of the largest in the United States. And this brings another aspect to care, which is cultural sensitivity and unique medical problems, including communication skills that serve you well after graduation.
Minneapolis is a very vibrant city. We have a lot of professional sports teams, college sports teams, and there's also a lot of arts and music scene here. Plus the restaurant's also very good, so I think it's a great city to be in.
I very much enjoy being outdoors, fishing. I love going up to the lake. There's just so much to do from an outdoor perspective here that it truly fits with anyone who truly loves the outdoors.
So one thing that's unique compared to many other programs is the opportunity to do research. We encourage all the fellows to do research, and we give them some time to do research. And there's a tremendous detailed database on both donors, living donors, and recipients, which is accessible to any of us along with statistical support.
I think research is one of the huge strengths of this program. There's so many research endeavors going on here, from basic science, including organ cryopreservation and xenotransplantation, to traditional clinical database outcomes research. There's definitely a lot of support and opportunities for research here at the University of Minnesota.
I've had an amazing amount of support for my research. I was very focused and dedicated to having a research career, and the University of Minnesota has a tremendous amount of resources and quite a few faculty involved in research.
The obvious benefit in coming to the University of Minnesota is the well-rounded training, but another benefit is the wide network that we as University of Minnesota faculty have developed through the years. This gives us an extensive network to be able to connect to seek opportunities for our graduating fellows and be able to place them in the best positions possible.
We do have a track record of training one of the most successful transplant surgeons in the country, and more than a third of the transplant programs in this country are led by fellows trained at the University of Minnesota.
There's a saying in surgery that if I can't watch you do the surgery, then I don't know how to do it, because I should be able to assist you doing it, set you up, and then if there's a problem, fix it. And that's really the mantra of Minnesota transplant surgery, that we expect that when you're done, you can do all the same things we can do, and if not, then we haven't done our jobs.
For me, that's a huge reason to come here, is that the team here and the faculty really are dedicated to making sure that you have the experience you need to carve out the career you want to carve out.
I think one of the major benefits in coming to the University of Minnesota for Transplant Surgery Fellowship is the long history that we've had here in developing leaders in the field that go on to many different positions around the country, but they're well trained as surgeons. That's recognized as people finish the fellowship here. They're ready to take on the challenges that come with being a transplant surgeon, and I think people know that across the country as you go to find a job.